Hello, my name is LaTroy Levine, and this presentation is about telehealth. A definition and relevance of telehealth to health informatics. Telehealth is the use of digital information and communication technologies such as computers and mobile devices to access healthcare services remotely and manage your healthcare. These may be technologies you use from home or that your doctor uses to improve or support healthcare services. Telehealth is relevant to health informatics because it has the potential to improve the quality of healthcare and to make it accessible to more people. Telehealth may provide opportunities to make healthcare more efficient, better coordinated, and closer to home. Some ethical issues associated with telehealth are privacy, security, confidentiality, and personal relationship. Privacy. The concern over privacy is legitimate. Patients may not know exactly who will be responding to or sharing their personal medical information. That information is available on different devices and computers, increasing the potential for security breaches, which may undermine patients' acceptance of telemedicine. With asynchronous communication, a lack of clarity about who exactly will respond may raise further privacy concerns. To gain patient confidence, it is essential that a robust privacy and security plan accompany any new telemedicine program and be communicated to patients. Security. Detailing the security risks and appropriate security controls for telehealth systems, including involves specifying what kind of security threat they should protect against. In telehealth, delivery models involving provider to provider communication, the entities at both ends are typically required by HIPAA to implement appropriate security safeguards such as authentication and data encryption measures. Confidentiality. Basic rights of an individual to have personal information disclosed to others without that individual's express informed consent. Information disclosed should be limited, required only to fulfill the specific purpose. Personal relationship. Patients have a right to expect that doctors will not disclose any personal information which they learn during the course of their professional duties unless patients give permission. Laws, regulations, or voluntary standards. Privacy Act of 1974, HIPAA, High Tech Act. The Privacy Act of 1974 regulates information collected by the federal government and its agencies. The legislation allows citizens to know what information is collected about them, assure the veracity of that data, and obtain copies of the information. HIPAA, the Insurance Portability and Accountability Act of 1996, was enacted to allow countenance of health insurance coverage in situations involving job changes or loss. Major provisions of this law was enacted to formulate and regulate federal guidelines and standards pertaining to electronic healthcare. Standards were developed to allow for identification of providers, health insurance plans, and employers, including the National Provider Identifier Standards, which provides every physician with a unique number used in all aspects of healthcare. The High Tech Act. The Health Information Technology of Economics and Clinical Health Act of 2009 empowers the Federal Department of Health and Human Services to oversee the promotion of the health IT, including quality, safety, and security, as well as the secure information exchange. Associated data capture tools and technology. Telehealth involves a diverse set of public and private data collection systems, including health surveys, administrative enrollment and billing records, and medical records used for various entities, including hospital, a CHCs, physicians, and health plans. Because hospitals tend to have information systems for data collection and reporting, staffs who are used to collecting registration and administration data, and an organization culture that is familiar with the tools of quality improvement, they are relatively well positioned to collect patients' demographic data. A specific example of telehealth in use in healthcare. A specific example of telehealth in use of healthcare would be when my grandmother was sick in the hospital at Southern Regional Medical Center in Georgia. The doctors and nurses were on a conference call with other doctors at Greater Memorial trying to diagnose my grandmother's illness. They collaborated and came up with a definitive course of action to treat her. These are the references that was used. This will conclude my presentation. Thank you.